and then the cluster numbers, okay, because we're analyzing the cluster separately. The cluster is about 20 hotspot zip codes. Again, 20 zip codes, that's out of a universe of 1,740 zip codes, just to put the size of it in perspective. The 20 zip codes are the same ones we were looking at yesterday. Rockland, Kings, Orange, primarily, and a little bit in Nassau. Rockland, the number one zip code in Rockland was 10952. That was a 17% positivity. Second one was 10977. That was a 14% positivity. You then go to Kings, Brooklyn 11230, 8%. Brooklyn 112046%. Brooklyn 112195%. Brooklyn 112234%. Brooklyn 112294%. Brooklyn 112104%. Brooklyn 11234%. You get the drift. The overall positivity rate in all 20 is 5.5%. That's about 5 times the infection rate statewide. The infection rate in the state outside of the hotspot zip codes is 0.82, which is very good. If you include the oversample in those hotspot zip codes in the overall state number, which by definition is going to skew it because you've oversampled the zip codes that have average of 5%, it's 1.02. But it's those hotspot zip codes that we have to watch, because if you don't control a cluster becomes community spread. If we didn't control the New Rochelle hotspot early on, it would have become community spread. If you remember, we created a containment zone around New Rochelle, which was actually an unfortunate use of words. Containment zone scared people, made it sound like we were containing people in the zone. We didn't do that. It was a containment zone meant to describe containing the virus. People were free to come and go, but I called it a containment zone, which was not the best choice of words when people are anxious. But we drew a circle around New Rochelle, and then we did a lot of testing, etc. So we're going to be just as aggressive with this cluster. These 20 hotspot zip codes have 23% of all the positive cases reported in the state, but they're only 6% of the population. Just to give you an idea of how different these zip codes are. 9 New Yorkers passed away yesterday. There were now thoughts and prayers. 605 were hospitalized. 144 were in ICU. 67 were intubated. If you look across the state, Capital District, 0.5, great. Central New York, 0.4, great. Finger Lakes, 0.3, great. Long Island, 1.3, not great. New York City, 1.2, not great. Hudson Valley, 2.4, really not great, but that's going to be Orange and Rockland. Mohawk Valley, 0.3, North Country, 0.2, Southern Tier, 0.6, Western New York, 1.1, not great. Rockland 6.5, Orange 1.9, Brooklyn 1.8. And what's driving Orange, Rockland, Brooklyn are the hotspot zip codes. Now, I spoke to the leaders of the Orthodox community this morning, and we had a good conversation. I have worked closely with the Orthodox community for many years on many unique issues. The Orthodox community in Orange, Rockland, Brooklyn has presented in the past unique issues in terms of housing, in terms of education. We've had community issues, especially in New York City with the surrounding community. So I've worked with them on a number of issues. I explained the situation frankly and candidly, and we had a good exchange. I think it's fair to say the leaders of the community understand, and they're going to take action, and we're going to come up with an action plan. There'll be a second discussion at 3 o'clock this afternoon with the Health Commissioner, Dr. Zucker, who's on the phone, to come up with an action plan. How do we educate the public? How do we use the media? How do we use the newspapers that circulate in the community, the radio stations in the community? How do we have community meetings? How do we get the word out? We have another religious holiday coming up this Friday, and how do we make sure that we have a different sense of behavior? And they have said that they are committed to taking a more aggressive stance. We talked through the myth of herd immunity. The president has spread misinformation about herd immunity. We're nowhere near herd immunity. And Senator Paul Rand went through this with Dr. Fauci, and Paul Rand was just wrong on all the facts that New York has herd immunity. New York City, we have about 18-19% infection rate. Herd immunity, you need about a 50 to 60% infection rate. To get from 18 to 50 or 60%, a lot of people have to die to get to that percentage. And all that means is the majority has been infected. The remainder, if they get infected, they have a possibility to die. And with this disease, now we're learning people can get infected a second time. The scientists were wrong. If you're infected once, you have the antibodies, you can't get reinfected. Now we're finding out that you can. Sweden tried herd immunity, and it was a debacle extraordinaire, and they then reversed themselves. That's the only place that really tried it. The local governments must do compliance. I've said that a number of times. It is a state law, and the localities must enforce it. The localities, and we're talking about Orange, Rockland, New York City, Nassau, that has a couple of communities affected. They have to enforce the state law, and they're not doing it with enough diligence, period. It is not up to them to say, well, we're not going to enforce the mask ordinance. We're going to offer a mask. It's too late in the game to do that. We have done all the public information on masks that you can. We have done dozens of mask public service announcements, dozens of celebrities. We've spent millions of dollars doing television ads on masks. The cable news is filled with reports on masks. It is not a function for the local government to say to someone, it would be nice if you wore a mask. Can I give you a mask? We're past that point. That's not compliance. That is public education. We're past public education. We've been doing this since February. It's not about public education. Enforce the law. The local government's failure to enforce the law has exacerbated this problem. They've made it worse, not better. It's not that people don't know there's a mask ordinance. They know there's a mask law. They're defying the law. And that's when you need to enforce the law. I understand the sensitivities of this political environment, and no one wants to enforce a law because then you make the other person unhappy, and nobody wants anyone unhappy. You know what makes people really unhappy? Dying makes people really unhappy. Loss of a loved one makes people really unhappy. Their child going to school and getting COVID makes people really unhappy. The infection rate going up and then having to close businesses makes people really unhappy. So local governments enforce the law. If you are unwilling to enforce the law, I will enforce the law. The state police, I don't have the numbers to do statewide enforcement. I have about 5,000 state troopers. New York City has 35,000 NYPD. If they don't want to enforce the law, I will enforce the law. I would need the local governments to assign a number of their police to the state police for a task force, and then I will enforce it with the task force. And I will ticket people who don't wear masks, because that will save lives at this point. We know how to keep the infection rate down. We're just not doing it in these clusters. And that's a failure of the local government. We've seen this with bars, restaurants. I put together a state task force, and the compliance went way up. Why? Because people didn't want to be ticketed, and they didn't want to lose their licenses. So we know that compliance works. We know it. And we know the bars and restaurant situation was much worse until I did a task force that did bars and restaurant compliance because the local governments wouldn't. And the situation got markedly better. Bars and restaurants are a relatively small universe because they're licensed by the state. Mask compliance among the general population is a massive undertaking. They're not doing it. And they have no discretion to change the state law. And when a local government says, well, I'm going to, I warn people, I offer them a mask. No, it's you're breaking state law, local government. Those initial publication efforts are over. So you are complicit in this situation. You don't want to do it politically. I don't have the personnel. Assign a number of your police to a task force. I will do it in my name, and you can blame me. I have no problem with that. I put my head on the pillow at night saying I saved lives. That's how I sleep at night. And I know we have. I know this type of activity, incompetent, ineffective government, will cost lives. We've seen it from Trump. He has cost lives. Why does this nation lose more people than any nation on the globe? Because we have an incompetent federal government. I'm not going to let that happen in the state of New York. And I'm not going to let it happen because we have incompetent local governments. It's that simple. This is not about politics. It's not about personal. We're well beyond that. It's a matter of life and death. Either you do the job or people die. It has that clarity of situation. It's like in war. Either the troops execute the plan and they win the war and they have as few casualties as possible, or they fail to execute the plan and more people die than necessary. Slightly dramatic, but not that dramatic. When you talk about 200,000 people dying, when you talk about 1,000 people dying a day, it is deadly serious. That's where we are. Final comment on Mr. Trump in the debate yesterday. It was not only the most disrespectful, chaotic debate, as many people have reported. To me, it was the most frightening. You had President Trump say at the end of that debate, the results could take months. I want a fair result. And his implication is, if it is a fair result, he will win. And if he doesn't win, then it wasn't a fair result. He's already talking about ballot fraud, mail-in fraud. He's been doing it for weeks. He has his attorney general talking about it. Let me ask you this. If you believed you were going to win the election, why would you be discrediting the election? Why would you discredit it if you thought you were going to win? If you thought you were going to win, you'd be saying the opposite. I can't wait to count the ballots because I will win. He sees the polls nationwide. He knows he's losing. That's why he's discrediting the election already. And what he is saying, and this is a president who can say what you want, but he always tells you where he's going. Where he's going is, he's going to say there was fraud in the election, and therefore he doesn't accept the results, and therefore he's not stepping down, and he's going to create a constitutional crisis. That's where he's going. When he says there may not be a result for months, that is not a person who thinks he's going to win the election. That is a person who thinks he's going to lose the election, and he's not going to celebrate on election night, and he's then going to prolong it with allegations of fraud. And how the story ultimately ends, we go to the Supreme Court, and we count chads and mail-ins and late mail-ins, and hopefully he has enough friends on the Supreme Court to skew the election his way. That is what he is now telling you. There is no way a person discredits an election if they believe they're going to win. Freudian Principles 101. Questions?
At this time, to ask a question, you will need to press star 1 on your telephone. To withdraw your question, just press the pound key. Please stand by while we compile the Q&A roster. first question comes to the line of Bart Jones from Newsday. Your line's now open.
Hi, Governor. I was wondering in your discussions this morning with the Jewish Orthodox community leaders, did you get any understanding of why is the virus spreading in these communities? You know, why are they not wearing masks? Why are they not socially distancing? Are they buying into this myth, as you said, of the herd immunity? I've also read that, you know, a lot of these communities apparently support President Trump, and Trump does not really believe in the mask that much. Did you get any sense of like why this is happening, and really what can you do about it?
Yeah, but it's a combination. It is. Now, you remember, we talk about the Orthodox community like it's a monolith. It is anything but a monolith, right? You have different sects within the Orthodox community, and we talk to all of them. Some believe in herd immunity. Rand Paul, theoretically a doctor, theoretically a senator. Rand Paul says herd immunity, that's what's working in New York. He had that debate with Dr. Fauci. Rand Paul doesn't know what he's talking about. I don't know if he was Rand Paul is a witch doctor. I don't know where he got his certificate, and I don't know what kind of mind-altering substances he's taken to come up with his conclusion. But, yeah, some suggest herd immunity, and we talk through that. Some members of the community, like some members of the general public, believe President Trump. Don't wear a mask. And they watch his rallies. Some people believe that. There was no one raised a religious belief against masks or any of the compliance. So there was no religious objection raised. Some people raised the point that local governments are supposed to be doing enforcement. And where was the government enforcement? You know, the suggestion, Bart, well, the community should be doing its own compliance. You know, we haven't said that to any other community, right? We haven't said to the Italian-American community or the Catholics or the Muslims, you are responsible for your own compliance. Local government does the compliance. And so one theory is, well, where's the local government doing the compliance? And they haven't been. And if the local government does the compliance and says to people, here's a ticket, wear a mask, then people are going to wear a mask. So it's all of the above. There was no one point. But I think the theories, herd immunity, President Trump says you don't need a mask, the local governments haven't done their job. I think those were the top three rationales.
Your next question comes from the line of Steve Marth from Spectrum News. Your line's now open.
Hi, Governor. Reaching out to see what the status is for having Bills fans or returning to Bills Stadium for Bills games in the upcoming month or so.
Yeah, it's something we're looking at. I spoke with the commissioner. I understand the plans they're working on. We're watching. We have a complicating factor in Western New York because we have a higher infection rate than other parts of the state. And we've had the caution flag up in Westchester. I think it was in Western New York, I think it was 1.3% today. So we're trying to get the infection rate down. It's something we're looking at seriously. I'm going to go out and take a tour of the stadium and meet with the team leadership and talk it through. Is there a way that we could, with the design of the stadium, get people in and out without causing a gathering? you can. The commissioner's point is, you can seat people socially distanced, right? They have some stadiums where they're doing like 5,000 people. So 5,000 people in a stadium, if you socially distance, if you spread them out, that would be fine. The question is getting in and out of the stadium without being in a quote-unquote mass gathering, right, without having that crowding. And that becomes more a question of the design of the particular stadium. Some stadiums have more egress than others. And I understand, I'm a big Bills fan myself, as you know, and we're excited about this season. So I'm 100% eager to get fans back at the games. But I'm going to go out, meet with the team leadership, tour the stadium. We have some engineers looking at the situation now and see if there's a way that we can work it out. I'm eager to work it out, but again, with safety, complicating factor, the overall infection rate in Western New York. But we're working on it. We're working on it actively.
Your next question comes from the line of Lucas Day from Finger Lakes Radio. Your line's now open.
Governor, you said earlier that you lie down at night and you can sleep knowing that you saved lives. What would you say to New York residents who lost loved ones in nursing homes due to your mandate back in early March or late March regarding sending COVID-positive patients back to nursing homes?
Yeah, I would say, first of all, that's not why they lost a loved one in a nursing home. Your question, the premise of your question, is just factually wrong. People who were lost in nursing homes were lost because that's where the virus preys. The virus preys on senior citizens. The virus was introduced in this country in Washington, state of Washington, in a nursing home. That's who succumb to this virus are immune compromised and senior citizens, and they're predominantly located in nursing homes. Number two, you look at the nursing home deaths in this state. Do you know what number we are by percentage before you made that statement? We're number 46 out of 50 states. And we had the worst problem, and we're 46th in terms of percentage of deaths in nursing homes. And number three, there's a whole report done with data. The way the virus got into nursing homes was from two possible carriers before we even knew about it. The staff, working staff at the nursing home, brought in the virus. Or potentially family members, before we stopped family visits, brought in the virus. And this happened at a time back in February when we didn't even know the virus was circulating in New York State. That's how the virus got into the nursing home. Well, why didn't we know the virus was in New York State? Because the federal government missed it. The federal government has the CDC, the NIH, they do international health care. They still thought the virus was in China. President, last night kept talking about China. No, it wasn't in China. It was in China in December. It then went to Europe in January and February. And the people from Europe then came to New York and brought the virus. And the federal government totally missed that it came from Europe. Federal government didn't do a European travel ban until mid-March. by that time, 3 million Europeans had come here. And why New York? Because that's where the flights from Europe come. They come to New York primarily, JFK, Newark Airport, etc. So that's how the virus got into nursing homes. If you'd like to actually understand some facts, I'll have them send you a full report that was done, and then you'll be able to help people with facts. Melissa wants to make a point.
No, just to punctuate what the governor was saying, actually some clusters that we're seeing right now, the one in the southern tier is driven primarily from a nursing home. I was reading an article about it and talking to people in the Department of Health, and it looks like the staff and visitors brought it in there, and now they're dealing with a really horrific situation in that nursing home. The same thing going on in the North Country. And again, it looks like it's being brought in by the staff and by visitors, which, we obviously try to balance all of this, and then people get upset with this really restrictive visitation policy, and rightly so, because people want to see their loved ones. But it defies logic to continue to say the March 25th order was the cause when you see it continue across the state today. And when you look around the country, and there are states that had some of those policies in place that were all in line with the CDC and CMS, and then you have states that didn't. And what you see in every single state across this country, unfortunately, is that COVID devastated nursing homes. And that the nursing home COVID is very close to what was happening in any given community. It's a direct result of community spread. So when you continue to repeat these very politicized lines, I ask you to actually look at the data, understand what's still going on today, 7 months later, even in areas of the state where the percent positive is very, very low, like the southern tier. And then you see these massive clusters in nursing homes, and the same thing in the North Country.
Yeah, and one other point. Ignorance doesn't help grieving people. The rule that the state had, which was from the CDC guidance, right? The state didn't make it up. They were following CDC guidance. Now you can say, well, state health department was stupid to follow the federal guidance, and you may have a point there. But the rule said the nursing home can't discriminate on the basis of COVID. The law also said a nursing home cannot accept a person who they cannot treat effectively while protecting the other residents. That's the law. The point of the two rules was if hospitals became overwhelmed, which was a real possibility, if not probability early on, that we'd have to discharge people from hospitals and they'd have to go back to nursing homes. And that's why the anticipatory rule was you can't discriminate against a COVID-positive person, but you'd have to be able to take care of them without infecting other people. And if you can't do that, you can't accept them. That situation never came to be in New York State. Because we flattened the curve so effectively, we always had available hospital beds. So we never scrambled for beds. And we never needed nursing home beds because we always had hospital beds. So it just never happened in New York where we needed to say to a nursing home, we need you to take this person even though they're COVID positive. It never happened. We had extra beds. We had extra beds at Javits. We had extra beds at emergency hospitals that we put up all across the state. So it just never happened that we needed a nursing home to take a COVID-positive person. It never happened. You know where it did happen? In Florida. Florida today is doing exactly that. They're forcing nursing homes to take COVID-positive patients because they need the beds in the hospitals. We never got near hospital capacity. So I understand the political time. I understand Trump. I understand where you are. But a loved one, having someone who lost a loved one, saying to them, Well, this was a government mess up. It was unnecessary. Your father could be alive. Your mother could be alive. Your grandmother could be alive. That's just incorrect, untrue, and frankly, it's mean.
Your next question comes to the line of Marsha Kramer from WCBS-TV. Your line is now open.
So good afternoon, Governor. How are you doing today?
Who is this?
It's your friend, Marsha.
Can you spell the name, please?
Marcia.
Oh, that's a complicated name. Yes, Marcia.
Yes, indeed, and it's mispronounced all the time. So, Governor, in the 9 zip code districts in Brooklyn and Queens that have high COVID rates, there are 80 public schools. Michael Mulgrew, the head of the UFT, has called on Mayor de Blasio to close those schools so that there can't be any community spread while the numbers are high. The mayor has refused to do that. I wonder what your position is on whether these schools should be closed and whether you think that Mayor de Blasio is doing the wrong thing by not keeping them closed.
Well, look, the principals union voted no confidence. Mulgrew is the person who approved the plan. The teachers union is the party that approved the plan. If the teachers union doesn't approve the plan, the schools can't open, right? You can't open a school without teachers. It doesn't work that way. You can't operate Uber without drivers. You can't operate schools without teachers. So that's between Mulgrew and the mayor, because they both created the plan. The principles are clear. The principles are we have no confidence. It's Mulgrew and the mayor who have agreed to the plan. If Mulgrew doesn't agree on the plan, then he's in a nonsensical position. I mean, it just doesn't fit, Marcia. If he doesn't agree to the plan, then the teachers don't show up. If the teachers don't show up, there's no school. So it's between Mulgrew and the teacher and the mayor. Next question, operator.
Your next question comes from the line of Nick Reisman from Spectrum News. From Andrew Sith from WNBC-TV. Your line's now open.
Goodbye, Nick.
Governor.
Hey, Andrew. How are you?
Hey, good afternoon. Governor, given your concerns that a cluster can turn into community spread, why not pause indoor dining in New York City, which begins today? Why not pause the indoor pools, some of the indoor gyms? Wouldn't it make sense to take a stronger, more precautionary action like you did several months ago?
Well, these are escalating actions. The first action is local government do the compliance. You want to go to step 4, Andrew. You close businesses, you close restaurants, you cause significant economic damage. What happened to step 1, 2, 3? How did you not do mask compliance? And I'm not saying mask compliance is mask compliance. I talked about this for 200 days. The communities that do it best have the best results. And I talked to local governments. They're still saying, we don't do mask compliance. We do mask education. This is not about mask education. Do you think there's any person in the state of New York who hasn't heard that they should wear a mask? I mean, give me a break. It's a little common sense at this point. Well, now we should go to close businesses. Look, we have escalating actions that we take. But do step 1 first. Enforce the mask compliance. Issue a ticket. Issue a ticket. close a mass gathering. How many pictures have you seen of religious ceremonies with hundreds of people? Are you telling me that the local officials didn't see them? Or they turned a blind eye? Let's be honest. They turned a blind eye. Well, open your eyes and do the compliance. And if that doesn't work, yes, then we're going to have to take more serious actions that, frankly, are going to be more difficult. And if they just do their job, we wouldn't wind up there. And if we have to go to those other actions, Andrew, it's because they didn't do their job. And this is the constant back and forth I have with them. Well, we don't want to do mass compliance. People are unhappy when we give them a ticket. Oh, yeah? People are more unhappy when we have to close their businesses and when we have to close their schools. And people are most unhappy when their loved one dies. So write the ticket for the mask. Close down the religious ceremonies that violate the gathering laws. Those are much easier than doing significant economic damage, especially at a time when we have this unemployment rate and this deficit. One more, operator. Did Nick Reisman drop off, or did you disconnect? Poor Nick.
We have Nick Reisman from Spectrum News. Your line is now open.
There he is.
Oh, I was having a Rodney Dangerfield moment there for a second. Governor, I was just wondering, I know you have the panel that is assessing the safety of any COVID vaccine, but I was wondering, what are your thoughts on how a vaccine should be allocated early on? Should it go to people who are living in nursing homes, in assisted living facilities? Should it go first to people who are nurses, first responders, people who are on the ground for stuff like this? Where should the vaccine go first when there is one?
Nick, it's a great question, and we have a committee in formation to grapple with those issues. And it's very hard, I can tell you that. And I want their input and their guidance because, this is, you're talking about whose life is most valuable, whose life is most in danger, who should go at the front of the line. Is it people in nursing homes? Is it the first responders? Is it the police officer, the ambulance driver, the train conductor who's been putting their life in jeopardy for months? Is it the person in a nursing home? If it's a person in a nursing home, is it a person in a nursing home that has had no COVID cases and no COVID deaths? Do you prioritize the nursing homes? And then it depends on how many vaccines you get. If you get a large enough supply, you don't have to make these choices. All of the above is the best answer here, right? But we can't even get a gauge yet of how many vaccines are we going to get. Is the first tranche of vaccines 1,000 or 5,000 or 100,000? How long between the first tranche and the second tranche? So is the volume going to be enough that you have a constant supply, and actually you have a greater supply than you can administer? So then you just administer as many as you can, as quickly as you can? It's complicated, and we don't have many of the facts, but I want to start to think through it now in the different scenarios. But I'm not prepared to answer those questions because they are really tough questions, and hopefully the volume we get is large enough that we don't have to choose. Okay, operator, thank you very much. Thank you all for being on the phone. Bye.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.